So let's talk about a little bit of lipo definition, which is a trending topic all around right now. And it's something really interesting, but a lot of people don't understand how does it work. So there's a lot of names in the marketing industry that they end up being sort of the same thing. You may heard of, instead of lipo definition, high def lipo. Also 3D lipo, high definition lipo. At the end, they end up being the same thing. I even may come out with 4K lipo, now that you mention it, or OLED lipo. Point is that they're a technique that causes depression of the fatty tissue precisely where the muscle's supposed to go in. We're talking about defining the muscles without actually doing anything to the muscles. We are creating the dense or the negative spaces, as we like to call them in surgery. So when we think about a fit body, you imagine how those muscles pop out. They happen because of hypertrophic muscles. Those muscles are bigger than they should be, they're more exercised, and the fat layer becomes more reduced. So the definition or the highlighting of those muscles becomes more evident. So when we're doing lipo definition, we're not treating the muscles, we're treating the fat. So what we're doing is making those muscles, even though they're not as hypertrophic as they should be, to highlight a little bit more. So we cause that shadowing of a hypertrophic muscle without the muscle being as big as it should. So which are the areas that we treat the most with lipo definition? Number one, it's always going to be the abdomen, where we can define the middle line and the oblique lines and make a much fitter abdomen. Other areas that we can achieve lipo definition are lower back and upper back, inner thighs, shoulders, arms, and in the case of male patients, the chest.